question I get a lot from men is, when do I need to have my prostate checked? When should I worry about prostate cancer? In general, most professional societies recommend getting screened or tested for prostate cancer 50 to 55. Not all of us agree with that, but those of us who specialize in prostate cancer often want you to start at age 50. However, if you have a family member who has prostate cancer, had prostate cancer, or died of prostate cancer, you need to start getting tested earlier in your 40s. I recommend age 40. And when I say a family member, I mean someone who we consider a first-degree relative. That would be father, uncles, grandfather. But interestingly, also, if your maternal grandfather, your mother, her father had prostate cancer, you also still have an increased risk for prostate cancer. It does not just go linearly through only the men in the family. Also for African American men, age 40 for testing and screening for prostate cancer, because African Americans have a much higher risk of getting prostate cancer than Caucasian Americans do. Hispanics and Asians are about the same, but African American men have a definite increased risk, so we recommend earlier testing. Another question that men have is, well, can we avoid that rectal exam thing? And the answer is, yeah, but I certainly don't recommend it. When we biopsy a prostate because we're worried about prostate cancer, there are two reasons. One, your PSA is elevated, your blood test for prostate cancer or prostate-specific antigen. Antigen you can think of as a marker for the cell. But the other indication is if we feel something firm or hard in the prostate. As I show men in the office, if you feel this part of your hand, that's called the thenar eminence, that's what the prostate generally feels like. What we're feeling like is what the knuckle feels like. If I feel that, then there's a likelihood that I'm going to recommend that we do a biopsy, even if your PSA is normal. But if you're only going to get one test done, get the PSA done. It's much more effective in the long run for us finding prostate cancer. But don't be afraid of the rectal. None of us like it, including urologists, when it's done to them. They prefer to do it to you and help you, of course.